Near-death and pre-death experiences, common global reports. Updated, November 17, 2025 by Dr. Mohammed Hossein Hariri ASL. Time to read, 10 minutes 46 views, no comments. What are near insights from hospices on pre-death experiences? Can a person in a coma hear you speaking to them? The white tunnel and visionary encounters. Number of documented NDEs in the US and their most common features. A well-known case, Maria's shoe and the out-of-body observation. Scientific perspectives on near-death and pre-death experiences. Behavioral and personality changes after a near-death experience. Near-death and pre-death experiences have been reported for centuries across cultures, especially among people who survive coma or come close to death. Many describe similar visions such as peaceful lights, white tunnels, or encounters with loved ones. These powerful accounts raise meaningful questions about consciousness, spirituality, and the final moments of life. In this article, we explore common global reports and the scientific and spiritual perspectives that shape our understanding of these events. View of near-death experience. What are near-death and pre-death experiences? Near-death and pre-death experiences are often discussed together, but researchers view them as two distinct phenomena. Near-death experiences, NDEs, occur when a person is clinically close to death but later survives, such as during cardiac arrest, severe trauma, or a coma. People who report NDEs often describe vivid sensations like floating outside the body, passing through a white tunnel, or seeing deceased relatives. Because these individuals return to normal consciousness, scientists can collect first-hand accounts and study the physical conditions surrounding the event. In contrast, pre-death experiences happen in the final hours or days of life, usually among people who remain conscious but are approaching natural death. These experiences are often more gradual and can include visions of loved ones, feelings of peace, or a sense of preparing for a transition. Unlike NDEs, pre-death experiences are not tied to sudden medical crises but to the natural decline of the body. Families, nurses, and caregivers frequently observe them, and they are documented across cultures with remarkable similarity. The key difference is that NDEs occur when death is temporarily reversed, while pre-death experiences unfold when death is imminent and irreversible. Insights from hospices on pre-death experiences. Hospice workers, nurses, and end-of-life caregivers often witness patterns in the final days or hours of their patients' lives. Many report that individuals nearing death frequently describe seeing deceased relatives, hearing comforting voices, or sensing that someone is present in the room. These experiences are usually peaceful rather than distressing, and families are often surprised by the clarity and calmness patients display during these moments. Caregivers emphasize that such visions are common across cultures and backgrounds, suggesting that pre-death experiences follow a remarkably consistent pattern. These observations help families understand that their loved ones may be experiencing a natural and meaningful part of the dying process. Can a person in a coma hear you speaking to them? Medical research increasingly suggests that some people in a coma may still be able to hear and process sounds around them, even if they cannot respond. Studies using brain imaging techniques show that certain coma patients exhibit neural activity when hearing familiar voices, especially the voices of close family members. This implies that parts of the auditory system can remain active despite a lack of consciousness at the behavioral level. Hospitals and caregivers often encourage families to speak gently to their loved ones in a coma because familiar voices may provide comfort and orientation. Many survivors later report that they remember specific phrases, tones, or emotions conveyed during conversations held at their bedside. While hearing ability varies from patient to patient depending on the cause and depth of the coma, speaking to a comatose person is widely regarded as both meaningful and potentially helpful during recovery. Visionary encounters. One of the most frequently reported elements of near-death experiences is the sensation of moving through a bright white tunnel. Survivors describe this tunnel as peaceful, warm, and inviting, often accompanied by a feeling of being gently pulled toward a source of intense light. This imagery appears in accounts from many different cultures, suggesting a universal pattern rather than a culturally learned response. Some individuals also report heightened clarity, profound calmness, or a sense of detaching from their physical body during this passage-like experience. Visionary encounters often occur alongside the tunnel phenomenon. People commonly describe seeing deceased relatives, friends, or spiritual figures who appear to welcome or reassure them. These encounters are typically brief but emotionally powerful, leaving a lasting impression even after the person returns to consciousness. Scientists interpret these visions in various ways, including neurological activity or memory-related processes, while spiritual traditions see them as signs of guidance or transition. Regardless of interpretation, these shared experiences remain among the most compelling and widely recognized features of near-death reports. Number of documented NDEs in the U.S. and their most common features. In the United States, near-death experiences, NDEs, are relatively well documented. The Near-Death Experience Research Foundation, NDERF, alone has collected over 5,000 individual reports. According to NDERF's own estimates, about 774 NDEs occur every day in the U.S. based on their dataset. NDERF epidemiological studies also suggest that around 5% of Americans, millions of people, report having had an NDE at some point in their lives. As for common features, many NDE reports share striking similarities. According to the International Association for Near-Death Studies, IANDS, the most frequently mentioned elements include intense feelings of peace, joy, and love, encounters with an unconditionally loving light, and sometimes distorted experiences of space and time. Other major themes, identified by early pioneers like Raymond Moody and later researchers such as Dr. Jeffrey Long, include out-of-body experiences, tunnels, bright lights, and meetings with deceased loved ones. A well-known case, Maria's shoe and the out-of-body observation. One of the most frequently cited examples of an out-of-body near-death experience is the case known as Maria's shoe, reported in the late 1970s at Harborview Medical Center in Seattle. Maria, a patient who suffered a cardiac arrest, later described leaving her body during the coma and floating through the hospital. She claimed that her awareness moved outside the room and up several floors, where she noticed a tennis shoe lying on a ledge near a third-floor window. She described the shoe's precise details, its position, scuff marks, and the way the laces were tucked under the heel. When she regained consciousness, Maria told a social worker, Kimberly Clark Sharp, exactly where the shoe was located. Sharp went to the spot Maria described and found the shoe exactly as she had stated, in a place that would have been impossible to see from Maria's hospital bed or anywhere near her room. While skeptics argue about interpretation, the case remains one of the most widely discussed examples suggesting that some NDEs involve perceptions occurring beyond the physical senses. Scientific perspectives on near-death and pre-death experiences. Most researchers agree that near-death and pre-death experiences are complex phenomena involving the brain, consciousness, and extreme physical conditions. Science, however, does not make statements about the afterlife because questions about the soul and life after death fall outside the scope of empirical research. As a result, scientific explanations focus on neurological and psychological processes, while spiritual and religious interpretations provide meaning beyond physical evidence. These two perspectives can coexist without contradicting each other. Behavioral and personality changes after a near-death experience. People who undergo near-death experiences often report noticeable and lasting shifts in their behavior, values, and overall personality. Many describe becoming more compassionate, patient, and less driven by material concerns. This change is so common that researchers consider it one of the most consistent aftereffects of NDEs. Individuals frequently say they develop a deeper appreciation for life, stronger empathy toward others, and a heightened sense of purpose. Some even report losing their fear of death entirely, viewing it instead as a peaceful transition based on what they felt or saw. These shifts can also affect daily habits and priorities. Survivors may become more interested in spirituality, self-reflection, and helping others, while becoming less focused on competition, status, or financial achievement. Family members often notice that the person becomes calmer, more forgiving, and more inclined toward positive relationships. Although not universal, this pattern is well documented across many cultures, suggesting that the emotional impact of an NDE can reshape one's outlook in profound and lasting ways. Share this post. Facebook, Twitter, LinkedIn, Pinterest, Telegram, print, email. About the author. Dr. Muhammad Hossein Hariri ASL. Dr. Muhammad Hossein Hariri ASL is an English and Persian instructor, educator, researcher, inventor, published author, blogger, SEO expert, website developer, entrepreneur, and the creator of LELB Society. He's got a PhD in TEFL, teaching English as a foreign language. Number of posts, 4218. Related posts. Hafez poem, The Blessing of Seeing the Beloved with English translation. Learn Persian online with 500 Persian lessons plus videos. Living with carcinophobia, fear of cancer explained. Thriving in life, success and happiness. Can you be friends with AI? Pros and cons explained. Website management tips and services. Related keywords. Afterlife, consciousness, death, experience, perception, spirituality.